Ever wondered how clinical biochemistry fits into the puzzle of modern medicine? Well, let's shed some light on that. At its core, clinical biochemistry is a field of study that applies the principles of biochemistry and molecular biology to human health and disease. It's like a puzzle solver, decoding the mysteries behind our body's chemical reactions to understand how it functions in health and disease. The relevance of this field is paramount. Imagine being able to diagnose a condition before it manifests symptoms or monitor a disease's progression in real time. This is where clinical biochemistry shines, providing crucial insights that aid in diagnosis, prognosis, treatment, and monitoring of diseases. From cancer to cardiovascular diseases and even genetic disorders, clinical biochemistry plays a central role in modern healthcare. And the exciting part? It's continuously evolving, adopting new technologies and methodologies to improve patient care. Now let's dive into some specific applications of clinical biochemistry that are revolutionizing healthcare. First, let's explore the role of liquid chromatography-mass spectrometry, or LCMS, in clinical biochemistry. LCMS is a fascinating technique, a marriage of two powerful technologies. It allows scientists to separate complex mixtures, identify the components, and measure their concentration. Imagine a biological sample as a bustling city, and LCMS as a microscope that can zoom in and identify individual inhabitants down to their unique characteristics. In the realm of clinical biochemistry, LCMS is used to examine biological samples such as blood or urine. It's like a detective seeking out compounds that could indicate disease. Maybe it's a protein biomarker that's unusually high, or a metabolite that's suspiciously low. These clues help doctors detect diseases early when treatment can be most effective. LCMS is also vital in drug testing and therapeutic drug monitoring, ensuring that patients receive the right dose of medication. Indeed, LCMS has become an indispensable tool in the clinical laboratory. Moving on, let's consider the essential role of biomarkers in disease detection and diagnosis. Now, what are biomarkers? Think of them as biological indicators, like flags on a map, signaling something noteworthy in our body. They are measurable substances whose presence can indicate a disease state, akin to how a raised flag indicates a captured territory. In the realm of clinical biochemistry, biomarkers play a crucial role in early disease detection. They can help us spot diseases like cancer and cardiovascular disease in their infancy, often before symptoms even begin to appear. For instance, elevated levels of certain proteins can signal the presence of cancer cells, while changes in cholesterol levels can hint at cardiovascular issues. This early detection is invaluable. It allows for more timely interventions, increasing the chances of successful treatment and improve patient outcomes. So, biomarkers are like the body's smoke signals, alerting us to potential health issues. Now let's turn our attention to point-of-care testing, or POCT, and the use of bioinformatics in clinical biochemistry. First off, what is POCT? In a nutshell, it refers to medical diagnostic testing that is conducted at or near the site where a patient is receiving care. It's about bringing the test conveniently and immediately to the patient, thereby providing rapid results. This can be a game changer, particularly in critical care situations where every second counts. Imagine a patient with chest pains arriving at an emergency room. With POCT, clinicians can quickly test for cardiac markers right at the patient's bedside. The speed and convenience of POCT can make a significant difference in patient outcomes, as it allows for immediate diagnosis and prompt initiation of treatment. Now, where does bioinformatics come into play? Bioinformatics at its core is the application of computer science to understand and organize information about biological data. In the context of clinical biochemistry, bioinformatics tools can help analyze and interpret the vast amounts of data generated by POCT and other diagnostic tests. More recently, machine learning, a subset of artificial intelligence, is being used to further enhance the power of bioinformatics. Machine learning algorithms can sift through complex datasets, identify patterns, and make predictions with higher accuracy. This can lead to more accurate diagnoses, better patient stratification, and more personalized treatment plans. However, these technologies are not without their challenges. For POCT, these may include the need for rigorous quality control, potential for user error, and the cost of implementing and maintaining the devices. For bioinformatics, challenges may arise from the need to manage and protect large amounts of sensitive patient data, and the need for specialized skills to analyze and interpret the data. Despite these challenges, the potential benefits are immense. POCT and bioinformatics are revolutionizing clinical biochemistry, making it more efficient, more accurate, and more patient-centered than ever before. Clearly, POCT and bioinformatics are transforming how we diagnose and treat patients. Finally, let's discuss the exciting field of metabolomics in personalized medicine. Metabolomics is the scientific study of chemical processes involving metabolites, the small molecules that are the building blocks of our bodies. It's like a snapshot of the body's chemistry at a specific point in time, providing a unique window into our health. In the realm of clinical biochemistry, metabolomics has an important role. It helps us understand how diseases affect our bodies on a molecular level. But more than that, it's a key player in the move towards personalized and precision medicine. How so? Well, by studying an individual's unique metabolite profile, we can uncover specific biochemical markers related to their health status. This allows us to predict how they might respond to different treatments, and even design therapies specifically tailored to their personal biochemistry. This means, rather than a one-size-fits-all approach, we can deliver more effective and individualized treatments. In essence, metabolomics is helping us tailor medical treatments to individual patients' needs. In summary, clinical biochemistry plays a crucial role in modern medicine. It's a discipline that's constantly evolving, pushing the boundaries of what's possible in healthcare. Let's take a moment to recap what we've explored. We delved into the application of liquid chromatography-mass spectrometry, a tool that's revolutionizing how we identify and quantify molecules, leading to more accurate diagnoses. We discovered the potential of biomarkers in detecting diseases like cancer and cardiovascular disease at their earliest stages, potentially saving countless lives. We also touched on point-of-care testing devices and their role in bringing diagnostics closer to patients. Combined with the power of bioinformatics and machine learning, this is transforming how we interpret and utilize medical data. And let's not forget the promising field of metabolomics, which is paving the way for personalized medicine and precision healthcare, tailoring treatments to individual patients like never before. In the world of medicine, clinical biochemistry is indeed a game changer. It's not just about understanding disease, but also about enhancing patient care and outcomes.